Does your elderly loved one get confused, agitated, or restless every single evening? I need you to listen closely, because this is not just getting old. Ignoring these signs could mean missing one of the earliest warnings of dementia. So many families just assume this late-day confusion is simple fatigue. They think, oh, mom's just tired from the day. But geriatric doctors, the ones who specialize in older adults, warn that there is a specific condition where these symptoms get worse as the sun goes down, and it behaves very differently from normal aging. As a mental health and nursing education channel, we here at the Psycho Nurse break down clinical conditions like this using evidence-based psychology and geriatric medicine. We don't rely on fear or speculation, just the facts. And by the end of this video, you will know exactly how to tell the difference between simple tiredness and something more serious. More importantly, you'll know when it's time to speak to a doctor. The condition we're talking about is called Sundowning, or sometimes Sundowner syndrome. They can become very confused and disoriented, not knowing where they are or what time it is. Some experience hallucinations, seeing or hearing things that aren't there. Trouble sleeping is a classic sign, as are verbal outbursts or even physical aggression, which can be very distressing for everyone. Some more subtle signs might include them completely forgetting conversations that happened just hours earlier. They might ask for dinner multiple times, convinced they haven't eaten. They might not recognize familiar people, even close family members, or familiar places like their own home. It's also common for them to follow caregivers around very closely, almost like a shadow, seeking constant reassurance. Caregivers often describe it in the exact same way. It feels like the person becomes someone else at a specific time, every single day. So here's the key difference between sundowning and normal, age-related fatigue. Normal aging fatigue can happen at any time of day, and it usually gets better with a bit of rest. It doesn't involve major disorienting confusion. Resting or napping doesn't make the confusion go away. It also includes impaired judgment and a complete sense of disorientation. If your loved one takes a nap and wakes up feeling refreshed and clear-headed, that's likely fatigue. But if they remain alert yet confused and agitated, that is not normal aging. Now for a critical question. Can sundowning happen before a formal dementia diagnosis? Yes, it can. And this is why it's so important to pay attention. While sundowning usually happens after someone has already been diagnosed, it can definitely appear before that, as the brain begins to undergo its initial changes. However, and this is a big however, it does not automatically mean dementia. Similar symptoms can be caused by other conditions. Things like delirium from an infection, an acute illness, side effects from a new medication, or even just severe stress can mimic sundowning. That's precisely why a medical evaluation is absolutely essential to figure out what's really going on. So how can you help a loved one if you're seeing these signs? Managing sundowning is all about focusing on routine and creating a calm environment. Doctors have several recommendations. First, keep a consistent daily schedule. Wake up, eat meals, and go to bed at the same time every day. Second, increase their exposure to daylight, especially in the morning, to help regulate that internal body clock. In the evening, do the opposite. Reduce noise, turn down bright lights, limit screen time, and generally decrease stimulation. Always check for and address any physical needs. Are they hungry, thirsty, in pain, or need to use the bathroom? Sometimes, simple discomfort is the trigger. Creating a calm, familiar setting can work wonders. but the most important thing you can do is not ignore it. If you notice these changes, please speak to a doctor. An early evaluation and diagnosis can dramatically improve the quality of life, not just for the person experiencing it, but for the caregivers as well. If this video helped you understand a loved one a little better, please subscribe to the Psycho Nurse for more science-based mental health and nursing education. Thanks for watching.